Welcome to Diverse Health Services, and we're excited to have you here today because you're going to learn some new stuff, and we're going to learn some new stuff about peptides. Now, it's pretty easy to find us today. All these sources, we're everywhere, and everybody's everywhere, so it's not that difficult to stay current. Dr. Jeff, Dr. Gil, everybody's putting out great content. We're welcome to have you watch it. It's free. Sign up. The world is small right now, and everybody can be contacted anywhere. We have patients in all countries, all continents, all states. It's very easy to reach out, and I want to say something. You have 3 guys here that have done this their whole life. It's all we've ever done. It's possible to get a second opinion from any one of us if you'd like a different opinion. We don't practice the same. We're all a little bit different. Everybody is. We share patients, and if you want to get a different opinion because you think something can improve, you can easily do that, and we all work together, and we don't take offense to that. Shipping, 1 to 2 days, the people are impressed, and the world's different. Shipping is fantastic. Please support your doctors. Big business is taking everything over. If you want guys like me, there's practitioners around the world. Support your practitioners, support your local doctors, because the world is being swallowed up by big business. If you want us to continue on, it's best to support us. Amazon ain't going to do nothing for any of you. This is always a work in progress. Stay tuned for our new website. It will be up in August, and you should be able to navigate it much easier. Now today, the public is very lucky to have access to lab work. I have weird genetic heart issues that they don't even know to look for. My kids carry it, my relatives have carried it. Check your vitamin D. You can really take health into your own hands. After what just happened these last few years, I can't believe anybody could trust them. Now, the reason I have a strong practice is because I had that well baby check when I was a kid, and it destroyed my health. I bailed on this system when I was about 12, 13 years old. I'm not going back. I take my health very seriously because what they did to me when I was well, I can't imagine what they're going to do to you when you're sick. I'm dead serious about this. I can't believe what they're doing to the people. Listen today, you're going to learn how to fine-tune yourself. You can run blood work. You can be involved in your health rather than give it to somebody who doesn't have your interests, because Moderna does not care about us. Now today, we're very lucky to have this young man that came all the way from New Jersey, and I got to tell you, he's put these peptides together. I just asked him some questions. I'm kind of impressed that his brain did this. You're going to learn some things today, and I'm serious when I say that. I'm kind of impressed at how well this young man attacked this company. You're going to be impressed yourself. He's the real deal. He's interested in health. Most of the presidents of the companies, Standard, Biotics, Zorex, I mean, these are real guys that are more caring about your health than profits. He's one of them. I can tell by meeting him. So enjoy the show. He's going to teach us some really cool things that you don't know about. And I'm trying to fine-tune my health, because as I'm getting closer to 70, you can look like this instead of what you're seeing out in the mall all day if you put a little effort into it. This is my life. I don't have expensive hobbies. I don't have expensive habits. I don't have hobbies that I expend a fortune on. I want to feel healthy. Taking my health very seriously after what they did to me as a kid, that's why I'm so all in. And if you've never been sick, you don't understand what our system's like. So enjoy Mr. Antonelli as he takes you on a new journey, and you're going to learn some new stuff that you've not heard before. Take it away.
Thank you so much. Great to be back here. I'm Michael Antonelli. I'm the founder and CEO of Healthgevity, and this company was built 20 years in the making. So I've been in the nutraceutical space, some of the leading practitioner brands, and during COVID, coming out of COVID, practitioners that I trust that are on the front line, helping so many people in their local community, urged me to take the leap forward and disrupt what was happening. Create formulas that nobody so far was willing to do. Identify ingredients, whether they're peptides, natural bioactives, incredible emerging technology that we can leverage, bring in to practitioners' offices all over the United States and utilize for you. So everything that we're sourcing and dosing is linked to emerging research. We are collaborating with frontline providers and researchers all over the world to select the best ingredient at the right dose in combination to create these unique stacks in your body that will modulate and impact multiple pathways to get you the results that you and your practitioner have in mind so you can reach your health goals and, more importantly, maintain them. So as you're seeing here, it's a really unique portfolio. We have the largest variety of oral peptides, and we're taking peptides, we're improving their bioavailability, and we're stacking them with other unique ingredients to, again, get you the results that you are seeking. So everything within Healthgevity is harnessing the hallmarks of aging. And what we want to do here is really hone in on health span, which will lead to better lifespan. But when we hone in on health span optimization, we can then focus on day-to-day decisions that make a huge difference in your overall quality of life. So without any further delay, we're going to get into the nitty-gritty of what is peptides. But our commitment for you today, our promise, is that you're going to leave this recording with so many tangible information. You're going to learn about one or more formulas that are designed to help you reach your health goals today. So let's talk about peptides. Peptides 101 will be our first section. And this is a really common question I get asked by patients, providers, consumers alike. What is a peptide? So peptides are chains of amino acids. So you're seeing here amino acids, 2 or more, usually 50, so 2 to 50, or in some cases 2 to 40 is going to be what a peptide is. And then larger blocks are going to be proteins. So if you're listening, the most well-known peptide is insulin. And so when we think about a type 1 diabetic and the role of insulin is for them. But also if you're listening, you may also have been hearing about semaglutide, right? The GLP-1 peptides. And you might have also had an experience with something like a collagen peptide. So there's all different sorts of peptides. There's thousands occurring, and even through some research partners, there's millions of peptides naturally occurring in nature. So identifying which ones we can deliver orally is what's key for Healthgevity. But peptides can be done as an injectable, it can be done orally, topically, and even as a patch. So let's go on and continue our journey about peptide discovery. So amino acids, when we think about Legos, or we think about Lego sets, small Legos here, right, individual bricks. But when we stack these bricks together to make something, we can form a peptide. But when we think about these big Lego boxes, the kits, when we design a whole environment, right, we see proteins. And these are so important. These are building blocks in our body. But there's more to that, right? What's the hype around peptides? Are they safe? What do they really impact and influence in the body? And that's what we're going to now get into. So what are peptides doing in the body? Just keep it super simple, foundational, balancing hormones, right? So if you're listening and hormones are a key area for you, definitely pay attention to what we're going to go over on this recording. Inflammation. Inflammation is the backbone behind so much, especially disease, right? How well you are or how sick you are. And if you're sick and tired of being sick and tired, listen up. The role of peptides for repairing and building damage that's accumulating in your body. Peptides are going to help restore that function naturally. And then strengthening immune defense. Isn't this a topic that's so critical for so many of us, right? We want to either rebuild immune resilience and restore immune function, and peptides can play a critical role in doing that. And then last but not least, we're going to talk about the role of mitochondria and the powerhouses inside all of our cells. And peptides have a huge opportunity to impact the health and the vitality of our mitochondria. So why do peptides work so well? Well, many peptides are natural, right? There's also synthetic peptides. There's also here the precise and restorative action. So peptides are communicating, they're restoring the communication within our bodies. So think about the power lines in your neighborhood. And many times we can lose power, and that could affect a single house, it could affect a block, it could affect a neighborhood. Peptides are there to fix the communication network within our bodies, and so powerful and so safe and so precise. And the beauty of peptides is that they're modulators. They're not forcing the signal, they're massaging the signal. So whether we're hyper or hypoactive, it's going to be there to restore function in the body, how we need it and when we need it. So oral versus injection. And we're going to talk about, many of you who could be listening, tried injection, maybe you heard that oral wasn't working. A lot of this is being debunked. So oral has a lot of really unique options. Many of us do not want to inject. And if we're willing to inject, maybe we don't want to inject as much or as often as we have to in order to get the result we need. So when we look here about enhanced convenience that oral peptides have, that's the main area. But then that leads to improved bioavailability. Now, not all peptides can be done orally, but many can. And the ones we're going to talk about tonight are the ones that we have great clinical confidence in that can be done orally. Now, reduced side effects. So you might have heard a friend, family member, you personally, redness in the injection site, itchiness, or just the tough compliance that some of the injections have. So many providers and their patients are looking at peptides orally as a first line of therapy or especially long-term utilization. You can also do a combination of injection and oral to attack the goal on multiple angles. So when we look at Healthgevity peptides versus what you're seeing probably getting advertisements for on social media, research only, not for human consumption. The peptides that we're delivering orally are nutritional supplements, and we are governed by CGMP or good manufacturing practices. This means that we have to test purity, potency, and stability at multiple stages, from a raw material to a finished formulation. The moment you declare research only, you throw out any need to follow any governing manufacturing. So it could be just us hanging out at the table, putting together some capsules, putting in a bottle, stamp it not for human consumption, and we wish you the best. So ones that we're talking about today that are available here are going through strict manufacturing guidelines, but also looking at human outcomes, clinical predictive outcomes. So we're taking the guesswork out of what you're selecting to put in your body. Super important.
Now, why we added this? I'm in my office and Jeff starts coming in. He said, you got to see this. If you've had difficult esophageal ulcers, you got that high up GERD, not down here in your esophagus. This is nasty stuff. Only the people that know this, it's difficult. A lifetime of omeprazole acid blocking medication actually makes it worse. The literature says you can take it 14 days or you have to stop. Everybody's been on it for 14 years. They've ruined their stomach. Try to get them off it, the rebound is horrible. So Jeff's coming in the office, he's bragging up this BPC 157. He said, you got to see this. This guy's had 30 years of heartburn. I'm pouring it down his throat, and this guy's getting fixed quicker. Now, these are difficult cases. All this antacid stuff, it's 14 days. Nobody has been told that. By the time you start waking up and realize you've killed your stomach, you're not digesting anything, the results he was getting with the throat, he wouldn't leave me alone. He said, we got to get into this. He said, you can't believe how much simpler some of these cases are. That's how it started. So finally, I listened. It all came about slowly, and that's how BPC 157. As you know us here, we're like the real deal. I'm impatient. If I didn't get results, I wouldn't be doing this. I'm amazed at how doctors can practice their entire career and not fix anything. They live in huge mansions, they got big houses, they got 8 cars, and I don't think anybody's gotten well. I would quit my job before I could live that life. I did not get in this to do that. I was the sickly kid. If this stuff, I want to get it quick, fast, Everybody's so sick, there is no shortage of business out there. Move along. These things speed up everything, and that's how Jeff got my attention. It was very impressive, and he wouldn't leave me alone till I went further with this. The companies that we use, pretty simple. I've been with Standard Process and Biotics forever. Healthgevity is a new thing. Doctor's Research is fantastic. Zorex is up and coming. It's outstanding. This is food. I live on this stuff. They got the best shakes. Look at the shakes that we're taking. I eat lousy and can look like this, pushing 70. I know I eat lousy. I tried to cover for that. There's nothing in the food. It's amazing what you could do as long as we have these companies. If you're not using them, you are missing everything, because the food supply in this country, as everybody is aware of now, is designed to destroy us. So I want to thank Dr. Jeff for pushing me till I got into this, and then this whole thing came about from there.
Gut health and inflammation. You guys know I'm pretty big on the gut health. A few years back, I did have a lecture, Health Begins on the Gut, that you can watch on YouTube. We run some cool panels at the office. We got LabCorp here to run the Sensitive 7 with our gut panel. We got the new KBMO kit testing that we're using a lot more of, as well as more integrative stool testing with the GI maps. And the Peptides has just been an awesome addition into our office to get quicker, faster results and less pills with our patients. Starting with this product right here. Prime Gut Health is a spore-based probiotic, heat resistant, stomach acid resistant, also resists other environmental challenges. It has an SBI component to help grab onto specific pathogens in the gut, mainly Candida, Staph, C. diff, H. pylori, E. coli, just to name a few of them. My peptide lecture, I did mention the case that I had a difficult case with C. diff, and it was this primary product that I finally rotated in the mix that we got her to stabilize with her gut. And today she's still doing great and stabilized pretty well. I'm going to let Michael chime in a little bit about this product as well.
Thank you. So look at Prime Gut Health to be the security system within your microbiome. What's important about this formula, its ability to be used and counted on short-term in acute situations, and even more so for maintenance. When we look at here the components, serum bovine immunoglobulins are there to bind to those pathogens that either don't belong in our gut or don't belong at the levels they're found in. You pair that with 1 gram of butyrate in the form of tributrin and 12 billion of the spore biotics that are great for sensitive stomachs, pH changes, hydrochloric acid issues, and then the astragalus. Together, it's all about how do we achieve and maintain tight junctions? How do we help restore and renoculate a healthy gut environment? How do we help after we're coming off an antibiotic dose or a regimen? This formula gives so much flexibility to your gut, both upper and lower GI issues, and certainly is a foundational piece that's going to be part of the journey and plugged into so much of what we're going to be covering for the rest of this presentation.
This is a pretty cool case that Dr. Tent and I shared. It was skin cases tend to be pretty difficult. He kind of passed this one off to me. And I took over this patient in actually just recent April, and a lot of skin issues. And we'll show you a picture in a second, but Candida problems that had was presented all over the body, and was prescribed a steroid, and it came right back. It's a patient that was in office and that we Skyped with from New Jersey, actually. And we ran the GI MAPS test, we ran the stool test, and started him on the Prime Gut support, the KPV supplement, and we eliminated the food sensitivities, bumped up his germ, treated the H. pylori and the staph, and just in a matter of a few months, he's 95% better. And you go to the next picture here, you can see exactly what we were dealing with here. This peptide alone has been phenomenal to help accelerate. The skin issues have been some of the most challenging cases that we've seen in the office over the years, and the peptides have been an absolute game changer for it. We had some questions, I believe it was from the Instagram stuff here. Best time to take this, I'd recommend anytime with food. Anytime we're trying to stick a good germ to the gut, we like to recommend it with meals primarily. And absolutely, yes, it could help with IBS, eczema, leaky gut, as you can see in this picture here. No contraindications as far as I'm aware of, as far as autoimmune and allergies. And yes, BPC 157, this was the primary peptide that got us into everything. I was playing around with this peptide for about 2 years off on the side, and it was the results I was starting to get on the side with patients that I brought this to Dr. Tun's attention that, hey, we have got to get into this. We're coating everyone's stomach with gastroside, chlorophyll, IPS, ochrapepsin, high pep, and just to get such fast, quick results with this one peptide alone was unbelievable. All these patients that have just destroyed their stomachs with NSAIDs, ibuprofen, Motrin, Advil, Tylenol, things of that nature, and just to get such quick results with this one alone was absolutely phenomenal. And that sparked my interest in looking into the other peptides. And still got to give credit to Dr. Silverman for the FMU program and introducing you and kind of going from there, which I'll let you chime in a little bit more about this as well.
So BPC 157 with PEA 500 is a game changer. Regardless of where you are in your health journey, even if you've reached that plateau, this is one you can have a lot of confidence in. BPC 157 is a chain of 15 amino acids. Consider this the Roomba vacuum, that vacuum that's moving around the floor, searching for things to clean up. And if there's nothing to clean up in a given area, it will continue to move to do its job. This is the peptide that's doing that in our bodies. It works systemically. It's identifying areas in the body to have a better response to heal naturally. And so this is one when you pair it with things like PEA, a lipid resolving mediator, something that our body naturally produces in response to pain and inflammation. When you stack these two together, both gut dysfunction, both on a musculoskeletal level, it's going to make a dramatic difference. It's not a formula you need to use long term. It could be short term, 30 to 90 days, and it has enhanced absorption with the saccharosate sodium. So when we think about any GI issues, when we think about recovery pre and post surgery, when we think about bone fractures, brain health, longevity, and even our weekend warriors and athletes, this is going to help put the body in a better position to repair, regenerate, and thrive.
Dana comes from the east side. She had issues with her vocal cords because she's a singer. So we used the BPC 157 with her, paired with the PEA, and her issues with her vocal cords was resolved how fast?
Within minutes.
Yes.
One of my patients who had a tricky gut, it's one of those serious health fellas that he's riding his bike 9 million miles every weekend. He's very serious about his health. He wanted to try this for his gut. So he's, unbeknownst to me, he's doing the BPC. He walks in the next time, he says, I didn't tell you about this. This healed my torn rotator cuff. I was impressed because I didn't know you had a torn rotator. He said, I didn't tell you about it. He said, I cannot believe what this did. So to watch what that did to his rotator cuff in less than a month, that starts getting your attention. These are pre-packaged signals. As you get older, apparently you can't make them that well. So when we got stuff all together, watch this happen a couple of times, it starts to get your attention.
This product is phenomenal. My top 3 peptides that I'm using and the fastest, quickest results, BPC 157, KPV, and Brain Boost, I say 90% of our patients are feeling some significant results with. And to put these two powerhouses together, BPC with the KPV, you'll see in a clinical case in a few slides of what I'm using and getting measurable results with a lot of patients. But I'm going to let Michael chime in about this product here.
So this is the trifecta, BPC 157 stacked with KPV and PEA, all at 500. So the two peptides here, BPC and KPV at 500 micrograms with 500 milligrams of micronized PEA. This trifecta is incredible for any gut dysfunction. When we think about mast cell, SIBO, Candida, anybody on a PPI, That's who should be looking at this to make a dramatic difference. Even KPV helping the body better respond to pain in addition with the PEA. So for those that are looking for a response and looking for the most potent combination we have within the portfolio, this is going to be the one to tap into to see what it could do for you.
And this has been one really cool case using this one pill alone. This gentleman comes up from Ohio, 63 years old, diagnosed with ulcerative colitis, and unfortunately had reactions with the medication, so he decided to try a different route. And this one supplement alone completely reverses colitis and was on a measurable level with the stool calprotectin level, where it was at 416 and down to normal range about 5-6 months later. It was actually just in last week, and he's doing really good. Some other gallbladder stuff that we had to fix up as well too, but feeling really good. I like this slide. I want this one to add in as well. BPC protects the liver, kidneys, and lungs. I'm using a lot more of this peptide alone when I'm pairing it with other protomorphogens to help kidney, lungs, other thyroid issues, and trying to help rebuild these glands from the inside out. I've got kidney patients right now that are floating the brink of having to possibly get a kidney replacement or go on dialysis. And this peptide and pairing it with glandular kidney is working great with helping my patients save their kidneys longer.
One of our trusted medical advisors, Dr. Kathleen O'Neill-Smith, gave us this great term that BPC 157 is the Swiss Army knife of peptides. When we think about that Swiss Army knife and all the gadgets and value it brings, regardless of the situation we may or may not be in, this is a peptide that we can count on for so much incredible activity in the body. Again, if you recall, this is the peptide that's going to work systemically and help the body naturally respond to an insult or an action. So here you're seeing wide range of activity. When we think about muscle and tendon healing and accelerating and helping the body better respond to that insult, supporting and modulating inflammation, that's going to be a big area of focus. IBD, IBS, Crohn's, colitis, any GI issues. Stomach ulcers, anybody on a PPI, pain, blood pressure, and even protective to the brain. So foundational. But let's look a little bit deeper on potential conditions to look at. So common uses, we'll look at foundational stack number 1, healing and regenerative properties of BPC 157. We'll see, and there's over 200 studies on PubMed getting us to this summary. Acceleration of wound healing, tendon and ligament repair, and even bone healing. And we've had countless testimonials of fractures and breaking of different bones and having BPC accelerate and sometimes speeding up twofold the healing process. Then we get into the GI area. I know we already hit on this area. Ulcers, right? Any of that stress in the gut, IBD, IBS. Neuroprotective benefits. The gut-brain axis is of real interest for a lot of ongoing research, and this has been a particular peptide that's coming up more and more in this area. Heart disease, still the leading cause of death in the United States. This is a peptide that could be utilized as a supportive agent for that area. And last but not least, immune system modulation. So impact on autoimmune diseases, which we'll talk about greater today, and enhancing resistance to infections. So again, this is a peptide that you can use for so many different areas, regardless of where you're at in your health journey.
When you see this one peptide alone, KPV, I want you guys to think anti-staph, anti-candida, histamine issues in the body, leaky gut, skin issues. You can see physical and measurable results using this one peptide alone when you're doing things like the KBMO kit test, the GI maps, whether you're checking muscle testing, whichever you prefer. But when you see markers like zonulin, LPS, and other leaky gut markers, this is one of the products that you want to go after aggressively with the gut. And I'll go over a clinical case in a second after Michael chimes in.
So KPV is a tripeptide. It is coined the antimicrobial peptide, really critical to help the body more efficiently respond to elevations of things like Candida and SIBO, zonulin, LPS, and so much more. Also really critical for anyone suffering from mast cell and pain. But we see here about all the areas, and it's a really nice combination with PEA as a refresher, as a lipid resolving mediator, also critical for mast cell, for pain, for inflammation, both in the gut and in the musculoskeletal system. So this is a really nice combination of both of these working together for a full body repair and maintenance.
Autism cases could be a bit difficult. This was a pretty cool case that we had in the office that had some really good turnaround just with the KPV alone. He went through the ABA treatment, hyperbaric treatment, extensive functional medicine testing and all that, and just by this one peptide alone, he had significant change with his anxiety, speech, and attitudes, and his parents are very impressed with all the other testing and things that he's done and expensive therapies that it really made such huge changes with him.
So you might be thinking, is KPV plus PEA 500 for me? And when we look at some of the functions about what these two are doing together, complementary inflammation resolution. We think about things like NF-kappa B, PPAR agonists. Both PEA and KPV continue to come up in the literature as therapeutic options for this area. Barrier support, gut barrier support, tight junctions, the barrier protection, both KPV and PEA, both are well tolerated and dosed correctly in this formula to hit on this area of the scope.
Resolve Plus is a nice addition to our arsenal as far as inflammation goes. I'm going with clinical stuff as far as autoimmune inflammation, cardiovascular inflammation, and specifically like a lipoprotein little a, oxidized LDL, and some of these other trickier cardiac factors as well.
What makes Resolve so unique is that we're addressing the unresolution or inflammaging all the pathways responsible for this. So curcumin is one of the most studied bioactives around. We're using tetrahydrocurcumin stacked with theracumin super to provide a lot of value and hit the insult from different directions. Periliseed for Th1, Th2 support. Acmello, which is incredible for acute and chronic pain modulation. It's actually coined the toothache plant and was given years ago on the island of Sardinia in folk medicine for tooth pain. Then we have things as the phytosome technology, quercetin and boswellia. And that's going to be great not only for mast cell as you continue to hear about this, but even pain starting in the gut. Astragalus and ginsenoside, RB1, is also in here to improve the bioavailability and the intestinal wall inflammation. So altogether, this is helping anybody struggling with excess inflammation, aches and pains, and a really nice foundational piece, as we'll talk about later, what happens when we can't resolve healthy levels of inflammation. So we want to get those in range. Skin inflammation, aches and pains, recovering slower than we want. And if you're getting the advanced blood chemistry that's offered here, you'll be able to look at several biomarkers and track that and see what this formula is doing to help get those back into healthy levels.
This is a more recent case in the last 2 months, 9-year-old female presenting with some autoimmune issues. She had the high ANA that we are investigating a bit more. We've got the newer LabCorp panel on the ANA cascade, so if that is someone that yourself or someone else that has that ANA being positive, you need to look further into it. This is one of the cases here, but she had issues with her skin, with the vitiligo, rash, stomach pain, and between her diet, treating her for parasites, and using some of the Resolve for inflammation control, she made some really nice progress here, which was pretty impressive.
With my journey with John Hancock Blue Cross Insurance, they made sure I was layered with so much infection from all the amoxicillin, all the augmentin, all the earaches, all the allergy shots. I got my nose soldered shut. It was quite an adventure. And all my friends without insurance are watching Randy go back and forth to the doctor, and it was embarrassing. So I can't believe what I went through, and learning to play the chronic infections that I've been left with. You can't take a lifetime of this stuff, mutate this stuff, drive it into your system. I spend more time on my immune system and chronic infections than any single thing. I got implant infections, I got a bone graft infection, I've had chronic antibiotic resistant strep from so much amoxicillin. And to find anything to help my immune system after it's been compromised, this is huge. Thymosin is big for the people that have basically had their tonsils taken out. You guys got to look at, nobody's brought this up yet. You look these labels up. These are patented, registered trademarks. They have bankable functions. They're guaranteed to do stuff. That's what makes it so unique. You take this, this happens, you start stacking these together, you can get real pharmacologic results. So what I've been able to do with this on my immune compromised people is to wake up things that they couldn't fight on their own. And Michael can go into a little more detail on that.
So a big focus in immune modulation, you're going to read and hear a lot about thymic peptides. Thymosin alpha-1, thymosin beta-4. With this formula here, we're isolating the 4 first amino acids occurring in thymosin beta-4. So it's the TB4 frag 1 through 4. And that's the workhorse behind a lot of the thymic peptides. And as you'll see a chart that we'll display later on, as we age, our thymic peptide production declines, and at the same time, chronic disease will creep up. So we know there's a correlation between the two. TB4 frag with the addition of thymogen, and thymogen is a bioregulator dipeptide, and these are working together to restore harmony and balance within our immune system naturally. So getting us back, getting the thymic gland back to when we were in our prime and keeping us there. So this is a peptide combination that's going to be great for repair, regeneration, and immune support and rebalancing.
For you clinicians watching this, you take Thymex from Standard Process or Thymoimmune, you put it with this thymosin together, you're going to notice an upgrade in their immune system. These kind of things happen. Look for the patients with no tonsils. We asked everybody about their tonsils. It's a whole different animal if you've had your tonsils taken out. This is very complementary to any lingering chronic infection. I've personally used it myself, and I've watched patients have crazy results with things that they could never fight. Our immune systems have been so compromised. Learn to complement each other with the kind of supplements that we can use individually. These things help us out. I'm going to let Dr. Gill take it from here.
Now, ImmunoRestore hits close to home for me, and I'm going to explain why in a moment. But one of the first ingredients in there is the 2-fucosyllactose. That's the most prevalent human breast milk sugar, naturally present in human breast milk, making up about 30% of the human breast milk sugars. Now, why is that important? Because that builds gut bacteria. That's where we get 72% of that immune system development. It works like a prebiotic, an antibiotic, in higher doses, antiviral, it immune modulates the immune system, and it inhibits pathogen growth in the gut by inhibiting them to attaching to the cell. Now, this is huge because if you're talking about the kids with failure to thrive, or like my daughter who was born without a thyroid, she also had something called breast milk jaundice. That's 1 in 40,000 kids. This would have been a perfect product to use with her to build that gut, because she couldn't take the breast milk. But in here, you have this sugar that comes from human breast milk that would work good at building her immunity. Look at those kids in your neighborhood. Look around. Most kids aren't too healthy in today's world, as you notice. They're confused and their immune system's suppressed. They need this just as much as anybody. But the adults can use it too. You find that adult with that weakened immune system, you want to think about this. Now, Michael likes also the human equivalent lactoferrin. Now, lactoferrin is great because it helps to sequester and deliver iron around the body where it's needed. It's very good at immune balancing, carrying oxygen to the muscle, and stabilizing that immune system. Something else, the Lactococcus lactis. Now, that's an active plasmacytoid dendritic cell. That's a mouthful. a rare type of immune cell, a bacteria strain, to provide comprehensive and innate and adaptive immune function. Now, let me tell you about this. These PDCs are located in the small intestine. Now, why is that important? Because normally intestinal bacteria, probiotics, aim to restore health by delivering the bacteria to the large intestine, thereby indirectly enhancing immunity. Whereas the PDCs are in the paired patches of the small immune system. So what's great about that is the PDCs are activated directly, subsequently stimulating multiple immune cells, which is a faster acting. Michael?
Yeah, ImmunoRestore is such a groundbreaking formula. This features the first ever bioidentical lactoferrin ever done, leveraging CRISPR fermentation. And this is truly a breast milk mimetic. Now, we know about the importance of breastfeeding and what that's doing for an infant. Researchers over the last 20 years or so have been studying other ways we can take those properties occurring in mother's milk and see how it could repair years of damage in an adult's gut and microbiome. And so when we look at the role of the 2FL HMOs, the Amuse postbiotic layered in with a really healthy dose of the bioidentical lactoferrin, which is also referred to as pink gold, this is going to help really relate and move the needle for any immune dysfunction, help maintain iron homeostasis. It's antiviral, antimicrobial, it induces autophagy. It's there to be the difference maker regardless of where you are in your health journey, male or female, young or old. This is a formula based on the ingredients included and, more importantly, at the doses they're in that match the published studies that a lot of our research partners are investing a lot in, so you can make sure you're taking the very best.
As much sun as I'm in, the last blood test I had was 38. Now, I don't seem to make vitamin D that easily. About 65 is the highest. Therapeutically, 80, 90, 100's ridiculously acceptable. They want us out of the sun. I spend as much time in this beautiful summer that we're having in the sun as we can, but I'm going to give this a try. I've not done this yet. I'm going to give this one a try over the winter time because I just don't seem to make vitamin D that easy. It's adequate, but I don't think it's therapeutic. So this is what I've been ordered to do. But as I'm enjoying the sun, I'll probably pick this up in the fall. But maybe you can shed a little light on this because I don't know too much about this one.
So Protect 10 is really important for those looking to optimize your fat soluble. So this includes vitamin A, D, K, and E with an absorption enhancer. So some of the big areas we have is that the majority of vitamin Ks on the market right now are in the cis form and not absorbed within the body. The only thing that we're absorbing is the trans form. So this features MK7 and the 99.9 all transform. So we're utilizing all of it. And at this level, we're inducing pathological calcification. So we're delivering high dose vitamin K with a healthy dose of vitamin D with the A and the E to help preserve bone, help strengthen a healthy heart, and support our immune system, and so much more. So what's also great about this, it includes estrogen, the astragalus, ginsenoside, RB1. What this is doing in here is helping your body absorb the fat-soluble vitamins. So many people are taking high-dose vitamin D on its own, getting a blood test and not seeing that marker improve. So we have, through our clinical partners, tested thousands of patients over the last 3 years on this formula and have seen so many blood chemistries evolve. So whether you're dealing with low vitamin D in the winter, you're one of those people that get sick, get better, get sick and spiraling, or you're looking to support bone and heart health, this is a formula to certainly consider. And as always, make sure you're getting the proper lab tests to see where you're falling with the fat solubles.
Now, I know Dr. Tent and Dr. Jeff would agree with me. It's kind of ridiculous with the ranges of vitamin D. They're way too low. 30 is it's what I call an empty gas tank. You got to remember what vitamin D does. it turns on your immune system. It's part of a D-binding protein that comes from your liver. That's part of a molecule that's a key that turns on the macrophage cell in the immune system. So 30 is an empty gas tank. In the literature, it'll tell you 60 is where you want to be. Now, if you're fighting cancers, I would say you want to be up around 80, 90 and that level. Now, this is a nice vitamin D because some people don't like the liquid vitamin Ds. This is more of a capsule and it's easier. So you'll find that it's important to make sure that they can tolerate that vitamin D too. But we had a case, 36-year-old female on 5/7/25. She's at 21.1, very low in the basement, as I would call it. Taking 2 capsules a day, by 6/19/25, she was up to 42.7. Now, she's not quite there according to the literature. She wants to be up around 60, but 42 is a big step up to where she was. And remember, vitamin D is hugely important for turning on that immune system.
You've heard me say frequently, get the diseases out of the way because you want to work on your head. Now, when I get up in the morning, I can guarantee you, I don't get up and say, I cannot wait to work with the public today. I've actually never said that. So number one, I'm kind of a loner. I fired a pediatrician when I was 12. I tried spitting the fluoride tray out when they're putting this junk in my mouth. I'm arguing with the teachers about evolution. I don't think I came from a monkey. My entire life, I'm running opposite of what they're trying to tell me. I argue with them in chiropractic school. Now that you realize our life's been mostly a hoax, and if you haven't figured that out yet, ask your friends to help you out. I like to work out on burnout. I like to work out on my moods, my emotions. You can't motivate me financially. I'm the youngest in the family. There's nobody younger than me. I enjoy keeping my moods up all the time because I'm just not naturally that joyous person when it has to work with the public. Soon, there's a big problem out there. Anxiety, burnout. We've had 3 alcohol-related suicides in the last couple of years. I can't believe what's happened to these people's minds. Personalities are changing. All over the literature, it says people aren't the same. People that got the jab are behaving differently. There's 3,000 to 5,000 people dropping dead right now. It is very disconcerting to us. The doctors are terrified because the young people are dropping dead. Everywhere you go, there's a catastrophe. And people are concerned about the Red Wings and whether the dumb things in life. There's a serious life going on here right now. I love playing my brain chemistry every single day so I can deal with Lipitor and flu shots and omeprazole and their 3 COVID boosters and all the nonsense I have to listen to all day. It drives me nuts. Now, when you notice this is trademarked, this is patented, this is trademarked, I took 2 this morning to lift my brain chemistry, to make it awake, BDNF, this is acetylcholine, there's your dopamine, everybody's trying to get to paraxanthine, that's your caffeine pathway, and theanine keeps you calm while you're awake. Learning to play brain chemistry because they're trying to make us depressed and anxious. You got to get through life with your family, your friends, your spouses. Don't be miserable. Work on your brain chemistry. Everybody's working about their bad leg or something. Your moods and emotions are more important. I take this very seriously because I have to take this because this is my 44th year of doing this. Everybody's burnout, stressed, or left by now. I was put here to do this, and I have to keep doing it because that's how I've had good health. I apply all this stuff to myself, and I thank God that I've had 44 healthy years, but if I don't take this stuff seriously, I'd be out of here by now. So keeping my brain chemistry up is a whole gigantic thing that has nothing to do with my symptom picture specifically. It's very important to me, and the way I meet most of you folks out there, it should be more important to you.
So if you're watching this and you're waking up fatigued, you're crashing in the afternoon, you have constant brain fog, you're not motivated, this is certainly a formula for you to consider. It is designed to work within 20 minutes of the first dose. Now, for those that are turning to caffeine-driven beverages, the coffee, the energy shots, the energy drinks, Many of us are fast or slow metabolizers, and we're not getting the ultimate benefit from caffeine. We can also build a high tolerance of it. So the beauty of this formula featuring paraxanthine is that it bypasses all of that. So you don't build the tolerance up. It actually gets better the more you take it. You don't get jitters and you don't get the crash. So we're bundling all the benefits, and then the supportive cast around it is putting our brain chemistry, our brain waves in a position to be locked in and fueled and focused. So again, Brain Boost is one for so many people to start with. Because if you're like many, you're sitting there not ready for change, not motivated. Maybe you don't want to pay for some of these other formulas. Start here, create change, reassess, and then we'll advance on the journey together.
August 18th of 24, Paul came in, facial droop on the left, his tongue was deviating to the left, and he had everything that looked like a stroke. Now, I want you to put your head straight, Paul. Put it straight. Stick your tongue out. Stick it straight out. His tongue would go so far to the left, it would touch the corner of his mouth. That's all gone. How do you feel now?
Feel a lot better and a lot more mental clarity.
Yes.
And I think these guys do a wonderful
Thank you.
job.
And now the other thing is, not mental clarity is there, focus is there. We use the Brain Boost. We use that boswellia, which I've always said great for brain inflammation with these stroke patients. The intenzyme, the proteolytic enzymes, everything keeps coming back. Your personality has come back.
My balance was off. Every time I got up, I was very aware of my balance, especially stairs. I feel a lot more comfortable about that now.
So we cleaned that clot right out of there now, and he's doing much better. Okay, so the patient you saw up there was Paul, and he had had a stroke, and he had problems from stroke. He had some paralysis, he had some speech delay, he had some other problems. Now, one of the things I like to play in the Resolve, you've heard about boswellia. I think that's a home run for brain repair. I also think the Lion's Mane, the Brain Boost, is another one. That's part of what the sequence of what I use for Paul to bring him out of this. And I watch week by week him slowly come out of this stroke with speech delay, paralysis, to the point where he's doing fantastic. You can barely tell he had a stroke. So thinking about stroke patients, you want to think about that boswellia, and you don't want to pass up the Brain Boost.
For you folks that have been in business, anything for a long time, I would tell you the first 20, 30 years of my life, you're kind of wore out, you're kind of stressed, you're looking for extra energy because that's the coffee people. There's a million ways to try to do that. As you get older, I think there's a different problem between stress, anxiety, what the government's done, what the churches have done, what the schools have done, what everybody's done. Anxiety is a different thing. If I could take any drug in the world, I'd take a Valium. I'd love to be able to dial in that relaxation, because the world right now does nothing but stir you up. I think we're being stirred up artificially right now, and I'll tell you why. In the middle of COVID, we all sat in our houses in that gigantic scam, and they put 5G towers everywhere. Now, my reception didn't improve this much, but everybody's anxious and stressed now. They're different. And I swear something's going on with that, but you talk about that stuff, you might end up in a ditch. But it's much harder to stay calm today because it seems to be different. Everything's different. People are stressed everywhere you go, and GABA is huge. Who doesn't want to learn to relax? It gets more difficult every day. This is huge. Now, if you look this up, and this young man has done a fantastic job. They're listing all these things separately. He wisely put them, it's cheaper to do it this way. You will read holy basil. This is the patented trademarked one. This actually raises GABA in the literature. L-theanine is trademarked. That raises GABA in the literature. Keep going. When it says, well, you got to have this weird germ in your gut, plantarum, that specifically, does it not? It raises GABA. Saffron is more expensive than gold. It's ridiculously expensive. It's trademarked right there. That raises GABA. Magnolia bark, look it up. That plays the THC pathway. This is huge. I mean, you take and watch, it's very difficult to raise the relaxing part of your brain chemistry. All of those. So to take that in the evening, look folks, if you're a worked up dude, start it in the morning. Learn to play your brain chemistry because it's difficult to make GABA work. They're taking Xanax, they're doing all kinds of things. There's all kinds of drugs out there for this pathway. Learning to play GABA properly, I think, is one of the biggest hits because when you're running constantly, life is no fun. Learn to calm down as much as you are waking up and learning to play this stuff in the evening or in the morning. If I had to fly 9 hours, I could take 3 of those things and sit in the plane and actually not come unwrapped. But learning to play this is a huge way to rest, and every single one of those is in the literature, patented with bankable results. I think that's a great pill.
Serenity is also known as nature's chill pill. It's designed to work within 15 minutes or less on the very first dose. So it's one of those formulas you don't need to take every day unless you want to. It could be delivered as needed. 2 capsules is the full dose, but many respond really favorably at just 1 capsule. You could do this 24/7, unlike some of the pharmaceutical options where you have a risk of losing motor function. This avoids that option while still giving you that relaxed state when you need it. So as you just saw, the dihydrohinochiol stacked with a GABA-stimulating probiotic, L-theanine, holy basil, saffron. It's a great combination for relaxing your body as you need it while also supporting a healthier, more positive mood. So check out Serenity.
How soon do you notice a difference with Serenity? I played with this myself. You know, first hour you feel a difference. It is definitely different than Mintran. Mintran is calcium, magnesium, potassium, which is the brakes on the body. So they kind of work from a different aspect for sure, but they both do have aspects that kind of help with cortisol issues for sure. Serenity we were using definitely for sleep issues as well, but now we're using Healthgevity, which is a newer product here. And new to the office, and it has some similar components to the Serenity, but has the L-tryptophan to help kind of convert to the melatonin, the holy basil to work with the cortisol, L-theanine with the GABA, and the germ to help keep GABA levels up. Does it work for you? Will it work for you? I like to measure things. I'm a huge fan of the Aura Ring, which we'll show you in a few slides, but I'm going to let Michael chime in on this newer product for us here.
Yeah, this is a huge area that we were getting consistent requests for. The connection and correlation between sleep and longevity is real and only growing. So if you're not sleeping right, everything else we're talking about isn't going to be as optimized and as beneficial. Deep sleep is where it's at. It's where our body's repairing and regenerating at its highest. And so when we were talking to a lot of our providers and researchers and you, the listener, about where you're struggling, whether it's getting to sleep and or staying asleep, we were really thinking about different ingredients and the literature and what it could do and when it could work. So with this formula, we took the base of Serenity, we've increased the GABA producing probiotic to 5 billion based on their latest human study. We added in L-tryptophan. We were very conscious to not include melatonin because so many of us, whether we realize it or not, don't do well with melatonin. But the star here is a brand new peptide, PeptiSleep. Through our partners Noritas, they were evaluating millions of peptides naturally occurring in nature, and over the last 10 years they identified a few dozen peptides that could play well for supporting cortisol, especially cortisol before and during sleep. And the peptide matrix that they ended up with through human evaluation is a matrix occurring in brown rice. And through utilizing a study and metrics like the Aura Ring, they saw that this peptide helped lengthen every phase of sleep and improved different heart rate metrics. So PeptiSleep paired with all the other GABA producing ingredients is a match made in heaven, right? We talk about restful sleep. We want to help get to sleep and then make sure we're not waking up groggy. We want to make sure our bodies are refreshed and ready to take on the day. This is the latest formula based on the most emerging and current technologies and one of the first oral peptides used in the world. So if you are looking at improving your sleep, you should definitely consider or read more about the ingredients contained in Sleepgevity.
I had a YouTube lecture, Health Begins Before You Wake Up, and it was all based on sleep. And I referred back to this Oura Ring pretty heavily. This is one of my readings from last week, actually, using the Sleepgevity products. I've got a routine that I use for my sleep stuff. I like my magnesium threonate. I'll play around with different magnesiums for sure, because that's one of the top deficiencies among Americans. And lithium orotate as well at night, and then I'll kind of sprinkle some other things in like this newer product here, and it works great. Dialing in your sleep, I tell you, it's huge for your immune system, your brain, your body. Everything reboots and recharges. I don't get nicked with these little colds like I used to with lack of sleep, and made a tremendous difference for my health there for sure.
So one of the questions we received ahead of time is, can it improve HRV scores? And in the clinical study that was done with PeptiSleep, yes, it can. This formula is designed to work on night one, but for those that have extreme sleep issues and also relying on prescriptions, it may take a few nights to get the full effects. So be patient, and hopefully you're investing in a sleep tracker to capture how bad or how well your sleep is and how much it improves utilizing Sleepgevity.
Insulin resistance. Doesn't everyone want to lose some weight here? Ignite Plus, this has been an awesome product in addition to the office here. When we first started using this, we were heavily using the CGM monitors in the office. And one of the first things I noticed initially is my blood sugar stability was a lot more controlled using this. And in the functional medicine world, this dihydroberberine is supposed to be a lot more beneficial compared to regular berberine and less GI effects, and using it at lower doses and still having the therapeutic effect. And I noticed that personally with myself, with my blood sugar, my lipid levels. With patients with losing weight, yes, it could help you absolutely lose weight, but you're going to see changes first in your blood sugar, visceral fat second, and then losing weight third. When we're addressing anything weight, especially myself here with patients, I like looking at saliva cortisol issues, full thyroid panel, food sensitivities, insulin resistant factors, absolutely. But you know, if you got the A1C anywhere pre-diabetic and above, 5.7 above, this is a product that you definitely want to incorporate for sure.
So the research shows that 8, maybe even 9 out of 10 people in the United States right now are metabolically sick and not where they need to be optimally. So this formula hits on all the underlying pathways to make sure we're addressing the root cause of the dysfunction. As you just heard, dihydroberberine outperforms berberine 5-fold. It also has twice the half-life. So for those that have tried berberine in the past but had GI issues, dihydroberberine is the answer. In addition, it features a cutting-edge satiety peptide called DNF10. In over 130 participants over 8 weeks at 500 milligrams, the average participant consuming this peptide was consuming 600 less calories per day. When you then layer in things like L-beta as an exercise mimetic and burning and beiging that white fat, layering in AMPK activators like the Innoslim and Actoponin, and even inducing thermogenesis through things like calorie burn. It's all about activating AMPK, supporting ghrelin and leptin, but more importantly, putting our bodies in a sustained way to balance blood sugar. So again, if you're listening and you've reached that plateau, you were losing some weight, you stopped, or you just weren't losing regardless of what you did, or if you're fatigued and suffering from brain fog, this could all be correlated back to poor blood sugar balance. So Ignite was designed to hit on all those root causes and something that you could look at integrating into a healthy diet, lifestyle, and a movement program.
So we got some cool feedback right away with one of our popular peptides that we're using, the Ignite Plus. This is the most natural form of Ozempic that you can find. Pairing this with the Stello and finding out what your blood sugar is really doing, helping patients lose weight faster. Here's a cool story.
Hi, so my daughter's been on the peptide for a little bit less than a month, and she has lost about a pant size, but she is working really hard, and I think the biggest thing we've noticed is that she has motivation to be like working out and being in the gym, where she didn't have that before. So I think more than the weight loss, we've probably noticed maybe just a mindset change with the Stello and being able to see what food does to her body, and then as well as just helping her have the motivation to be in the gym.
Yes, blood sugar fasting, there's a key thing that some of the other products that could help if your blood sugar shoots up first thing in the morning, especially before you eat, could be a cortisol issue. So one of the Sleepgevity products, or even Serenity with the holy basil, controlling some of that cortisol. Some people wake up first thing in the morning and they're just cranking right away with that cortisol, and their blood sugar's going. That might be a product to help them out a little bit more, but yeah, Ignite could definitely be a benefit factor as well. Who should take this? Anyone with weight concerns, insulin resistant factors, it's umbrella of people absolutely here. So.
Yeah, brain fog. I think those that are so busy with life, you skip meals, you don't have consistent food in your life, this could help just bring balance and sustain function.
Any side effects? The dihydroberberine, I have not had gut effects compared to regular berberine, and even in the herbal form with the berberine active. So for the most part, I haven't seen as many issues with this product that I could report.
Yeah, agreed. We have had tens of thousands of patients on this, zero impact. No jitters, heart racing. So a lot of the weight loss options on the natural side, when you're inducing thermogenesis, you could sweat a lot, right? You get the increase of heart rate. This avoids all of those concerns, which was part of why we selected each ingredient in there in the botanicals and what they can do or can't do in the body.
I do not see a reason that this would cause any deficiencies in people taking this. And Michael's explained to us this is best taken on an empty stomach prior to meals.
Absolutely. You do one before each meal, getting to your 3 capsule dose, or you can take all 3 in the morning. Because blood sugar is so personalized, you just want to play around with this formula to make sure when you take it, how you're taking it, you're feeling your best. You could also dose it on days, you're going to have a cheat meal and take a little bit before that meal on that day. And the last piece, these are what they are at the end of the day, supplements. So if you aren't making better food choices, if you aren't exercising, and we all have different definitions of what exercise is, you are not going to get the gains that you're seeking. So this, in combination with several other actions, even more reason to become a patient here to get that assistance and guidance and coaching.
Meat, vegetables, and eggs. Make it simple. Meat, vegetables, and eggs in that pill. Don't overthink this. It's that simple.
Cardio NAD. This has been a fun pill that I have just started personally playing around with. I'm still looking for more clinical feedback as far as pre and post testing with lipid levels with that bergamot fruit in there. But with the niacin, the nattokinase, I'm using this and liking this for my lipoprotein A patients, alpha-lipoprotein B. It's got components in here to help nitric oxide production in the body. So this is part of my new pre-workout regimen as far as incorporating 2 to 3 of these prior to my workout. If you've been a Dr. Temp patient for a while, we've always done the 10 Cardio Plus, 10 Cataplex E2. If you want to change something up and do something different, give this a little bit of a shot here, and I'll let Michael explain some.
As we touched on earlier, heart disease is the leading cause of death. We needed to get this formula right. Similar to Ignite, this is complicated, right? We got to focus and make sure we're supporting multiple pathways to get to the root cause of the dysfunction. On top of that, we saw emerging research pointing and correlating vascular aging and NAD decline. And I'm sure you're hearing a lot about NAD, both injected or precursors like NR or NMN. So this is hitting on supporting on a cellular level the root cause of NAD decline while putting our cells in a better position to make more naturally on its own. And that's through a unique ingredient called NAD3 stacked with niacinamide. We're also looking at elevated lipids, supporting healthy blood pressure, supporting the glycocalyx. And this really comes down to the microvascular system, right? To the capillaries. And that also means circulation and blood flow, oxygen to the lungs, and even fibrinogen levels or spike protein. So this has the nanokinase, the fucoidin, ACE-inhibiting peptides, a good dose of bergamot, 300 milligrams of CoQ10. So even anybody on a statin, if you are on a statin, this should absolutely be part of your regimen. Anybody listening with a family history of heart issues, this should be a formula that you should be on, and it should be a foundational piece for you.
This is one of my patient cases that I use the cardio NAD with, 59-year-old female, presented with some shortness of breath. This is a patient that I've treated heart issues with her over the last 10 years. She doesn't have any specific genetic heart factors, but we have treated her heart, and she had this odd poking sensation in her chest. We used the cardio NAD. She also had some dental issues, which we treated a subclinical staph infection, which we feel like was creating some of these issues as well too. But between the staph and the cardio NAD, treating those two things, her symptoms went away. Short-term use versus long-term use. I think as patients age, this is an awesome product for long-term use because especially the CoQ10, this is stuff that people need and is on a decline as you age. So it just works in their benefit to do something like that long-term, especially if you choose that. Not that we recommend to go to statin route for sure.
Yeah, and the great thing is that this contains ingredients that have publications to support utilization and positive impact on dose 1. So especially on the nitric oxide component, you are going to see benefit on the first dose. So you're going to see that, but as we just hit on long term, the more you take this, the better it's going to be for your body.
Can you take this with other heart medications? Yes. The one thing you definitely got to be careful with and not recommend if you are on any type of blood thinner, that natokinase would be definitely contraindicated. Can this help with lower triglycerides? You know, it's part of the lipid profile. I haven't done as much pre and post testing with it, but the bergamot fruit that's in there is supposed to kind of help with the lipid management, correct?
Yeah, we have a lot of practitioners that are doing advanced chemistry and on the blood side and seeing a lot of those markers be optimized that were out of range prior to using this formula.
Would it pair well with Ignite? Absolutely, because most of the insulin resistant issues that you're seeing are precursors to heart problems in the body. So if you're getting too much of the sugars, it's going to convert to triglycerides, LDL, dysfunctional lipid panels. So the Ignite's going to help with the lipids as well as Cardio Plus in the long run there.
So Prime Time Plus, when I see this product, I think cell protection. But before I talk about cell protection, talk about reducing oxidative stress and inflammation. It's everywhere. When you do a cardiac panel, you can see it in the LDLs. You just see inflammation and oxidative stress everywhere, which is oxidative stress damages the intracellular reactive oxygen species, which in turn damages proteins, lipids, nucleic acids, that increases intercellular damage, which leads to cell dysfunction and various disease may occur. Now, certain things in this product, like the sea buckwheat, that'll also help hormones because it's got omega-7 in it. So you'll see things like dry eyes and female hormone problems do better with this as well. But then you have the Cyanin Plus, which is a blue spiruline. It's a blue-green algae, and it's an antioxidant, reduces inflammation, protects against disease. The other things you'll find in here, like spermidine, it's a DNA stabilizer. It creates stability, cell growth, and tissue repair, especially in the brain as well. Then you have the ionic plex, which blocks allergic reactions, may reduce swelling, and slows growth of cancer. Now, I think of things like autoimmune conditions, rheumatoid arthritis, lupus, and MS when I'm dealing with this product. Anything that's going to protect that cell from internal damage to lead to disease process. That's what I use Prime Time Plus for.
So Prime Time is a powerful combination of plant-based stem cell mobilizers. It's there to recruit stem cells and bring them to where our bodies need them. That means more efficient repair and regeneration starting from the cell out. This is also really unique for a variety of different areas. When we talked about earlier the hallmarks of aging and supporting autophagy and cellular cleanup, this has so many ingredients that we found countless publications on that made a dramatic difference in having our cells become back to when we were in our prime. So it's all about turning back the clock and helping our bodies on a cellular level become more vital.
Xenoestrogens, this is something that we talk about with everyone at every single age range. I think this product should be incorporated with everyone's daily protocol in general. All the plastics, the chemicals, the fertilizers, pesticides, you want these things cleared out of your pathway. Now, from clinical aspect with patients and using this, I've had more of a positive response treating my breast cancer patients, pre-breast cancer issues, PSA levels responding a bit better with this. I've been pretty impressed with how it's turned the corner better compared to some of the things that we prior used with this product here.
We were grateful to work in correlation with some leading bioidentical hormone specialists to create a formula that helped the body better handle excess estrogen and also support the detox pathways. So with this, the base of 1 gram of calcium diglutarate and 300 milligrams of diindomethane paired with a powerful NERV2 activator like activated sulforaphane with the myrosinase enzyme included to make sure you're supporting the conversion on the microbiome and gut level. In addition, you have the fulvic acid and the astragalus ginsenoside RB1, and that's there to also help the absorption and utilization of all the other ingredients in here. This is a really unique formula, again, for those supporting estrogen levels and detoxification levels.
Zorex Dim and the Daily Dim, the primary difference is the Zorex Dim has iodine in it, so if you are iodine sensitive, we are going to be using the Healthgevity Dim Plus.
Now, I actually have the worst heart panel with the worst marker you can possibly have on your blood work. Me and Jeff were at a famous seminar down in Houston, Texas, with the guy that wrote all the books on how to treat the heart. He's a medical doctor, he's a cardiologist. I walked up to him and asked him after his seminar about my heart issue. I have lipoprotein small a. Pretty simple. It takes out, it'll get you. I looked at this guy whose name I'm not going to remember. Jeff was standing right there. I said, what do you know about lipoprotein A? He said, nothing. Nothing responds. I don't know how to treat it. And I just looked at Jeff. I said, take a picture of the two of us. These genetic markers are everywhere. I have a 0 plaque score and a 0 calcium score. I have to treat myself aggressively because it's a mess. It can easily take you out. You can't eat it out, you can't run it out, and you can't exercise it out. Run your tests. And that NAD that they're talking about is all over the literature. That's powerful stuff. And to have access, this guy put a whole bunch of things in each supplement. It's pretty amazing. Look at this list. I think he's knocked it out of the park. And it's trademarked and patented. These are pharmacologic response from nutritional things. Now, strength, recovery, and longevity. Last Monday, I came home from up north and I went to Frankenmuth. I stopped, I got the girls some fudge, and I got a chance to watch what the retired people look like on a Monday. I was horrified. I was speechless. Not the weekend. Go up in the middle of the week. Go have some chicken. If whoever's treating those people, everybody's the same. They're insulin resistant and they're estrogen dominant. Everybody was a pear. Everybody waddled. Nobody could breathe. They were beached. I'm ashamed. The money that we've spent to be in that shape, it was disgusting. I'm the age of those people. It looked like a nursing home and a hospital all combined together. Whatever they spend on their health, they need all their money back. Insulin resistant, low testosterone is everywhere. The DIM, the cruciferous, you got to keep foods in your diet to keep these chemicals out of your diet. It's embarrassing. It's everywhere. Now, to show you, I kind of mix my shakes up because I never counted on the food. I have a lousy diet. I eat dead things. My mother didn't cook well. My wife helps run the business. I'm not an eater. I eat to stay alive. I've been able to have a 44-year practice, 30 years of hockey in an adult men's league, playing 3 times a week, taking the supplements for me. We're all wired differently. Learn you. Now, this is important. This is the shake I'm doing. I can't get any more density. Give me a loose coney. Give me a Swiss Miss. I can eat anything around this. This is simple. I had jerky and that. I can have a Five Guys $1 million burger. I can't believe how expensive this food is. And that. This is all my vegetables. Look at the list of this stuff. I could never eat this stuff. There's my density. There's my shake. I get to go to my class reunion in about 2 weeks. It's my 50th year high school reunion. It's going to be a contest. Who looks the best? Who looks the worst? I'm going to get a chance to see what seed oils, fluoride, COVID shots did to my group. But that's what it takes to try to stay well. A very simple peptide shake, energy, strength, motivation. There's my DIM. Russell, all those green things keep those pathways open so the chemicals leave my body and I can eat lousy food and stay healthy. Nobody's eating right here. And the reason this is important is because Bill Gates put that appeal on everything. Every organic anything that he's made that you think is healthy has a pesticide sprayed on and it's labeled organic. This game's going on forever. Try to get out of the game. It's simple. These companies gave us easy access and everybody has access to this. If this was unique to me, I wouldn't want to talk about this. Everybody, any place, anywhere has access to this stuff. You want to use it because stay out of the game. They're trying to make you sick.
So talking about Prime Strength and why it's getting so much attention, it features the first powder dual peptide blend. So you have PeptiStrong, which has 3 human studies published. Double the strength, double the recovery, double the power, stacked with dileucine. And dileucine is the dipeptide form of leucine. It outperforms leucine head-to-head. It works quicker, it lasts longer. We stacked both of those with creatine monohydrate, which is the most studied form of creatine, with glutamine and taurine. This is a unflavored raw material blend that you can add and stack to any other beverage. This is what is going to activate muscle protein synthesis, fast and slow twitch muscle fibers, and improving stamina and muscle repair and recovery. So if you're focused on sarcopenia, which is age-related muscle loss, if you are focused or tackling prescription or immune-related muscle loss, bone density issues, or even if you're a weekend warrior or seasoned athlete, Prime Strength is a powder that you can easily integrate into your daily use.
They tell you giving you a slow pitch is like serving you up a softball. In my mind, Telomere Prime is like serving me up a softball. This is a wonderful product. The first ingredient I love, and I think it should be in everything, cat's claw. Known cancer prevention for over 100 years. Look into some of the research on it. Louisiana State University Center, cat's claw turns off tumor necrosis factor alpha production. This stops the inflammation. It also stops nuclear factor kappa beta, which also an anti-inflammatory switch that initiates cancer, shuts that off. It also boosts the T cell counts after chemotherapy, assisting in recovery of cells that have been damaged from the chemotherapy. To me, that's everywhere. To me, this is a product that should be used everywhere. In breast cancer, it affects the adenine, a nucleotide that is the basis of breast cancer cell DNA. Going on, the active broccorefin, that's a glucoraphin, a phytochemical in broccoli that has been processed to be more readily converted to sulforaphanes. If you know anything about sulforaphanes, it's in the stalk of the broccoli. This is wonderful for breast cancer. I love the sulforaphanes, and that's why I've advised broccoli and some of the other cruciferous vegetables. This is an isocyanate known for its health benefits on natural detoxification, antioxidant activity, and for natural cancer-fighting effect. These also remove environmental pollutants. Now, it contains buckwheat peptide. That's an antimicrobial, antioxidant, anti-inflammatory, and antihypertensive for blood pressure. Now, the jojoba in it, hydroxybenzoamine, investigating the effects of 2-HOBA on the pathogenesis of H. pylori infection of the stomach. 2-HOBA reduced gastritis for one, without affecting the stomach bacterial lining. It also showed a significant reduction in dysplasia and cancer development in the stomach. PQQ protects, we talked about the mitochondria, protects the mitochondria, the powerhouse of the cell. This is where we make all the ATP. Now, from oxidative stress, mediated lipid peroxidase, protein carbonyl formation, which is the breakdown of proteins, and ovoid damage to respiratory chain. This in turn will enhance memory, focus, energy, and overall brain health. So this is a product that's a softball to me. I think everybody should hit this one out of the park and be utilizing it.
This one was a tough one to name, but we know about the importance of telomeres, right? And for those that don't know about telomeres, it's the shoelaces, right? The whole shoelace analogy, the ends of our shoelace, and the more we wear our shoes, the shoelaces become frayed. And that's what's happening as we accelerate aging. But what we do know is as we strengthen the health of our cells, the domino slippery slope effect will be healthier telomeres. So this formula and everything it's delivering is not only strengthening the health of our telomeres, it is supporting the viral load, the inflammation load, while repairing damage done to the DNA and mitochondrial and our immune system. So for some, you may call this your longevity multivitamin. But for so many of us, this is going to be a game changer that we can utilize short or even long term in our wellness journey.
This is what we started with. We struggled with it, didn't we? What we did is we came across this peptide here called the telomere. Now, I love cat's claw. I love it for cancers. I love it for lymphatic drainage and everything. I said, you know, let's test the peptides. And this one came up. We put her on it, and now look at the leg. Much better, and it keeps getting better and better.
I'm amazed because I was embarrassed to even wear pants. This is what amlodipine does.
Yeah.
So I had bleeding capillaries.
So it was like a vasculitis. So between that medication that we work with and this, it's all gone, just about.
You know, one of the big mistakes in health today, everybody wants to take stuff and feel something. That's ridiculous. The older you get, things are breaking. All my friends are dead. Things are breaking on them that they never felt. I cannot, you know, it's amazing. All of a sudden, they got stage 4 this, stage 5 this. They're a mess. They were sleeping at the switch. Now, this is my life. I've taken more stuff than I should because I was a sickly kid. I can't imagine what they do to you when you're sick, because I saw what they did to me when I was well. I can't imagine what these people go through. Now look, we went out to dinner a number of months ago. I'm very impressed with that telomere. Go back to that slide, please. Alex Jones was talking about PQQ 20 years ago. These words that you see, these are When he talks about telomeres, this is aging. These are huge. This is the active part of broccoli. This is an incredible pill. Now, I told him I took all these pills home for my own personal, I wanted to test everything on me. I have all these infections, all this, I had allergy shots for 2 years. They made a mess of me. Had my nose soldered shut. I went through all that stuff because I could afford it, not because I needed anything. I took him this pill home. On a 1 to 10 scale, I checked for 11 of those. Out of all those pills at my age, I'm getting closer to 70. Psalm says you got 70, an extra 10 if you're lucky. I could not believe I'm down this. I do not take that many. But when I was shocked, I told him, I could not believe that pill tested more than anything. And I know all these things, I'm repairing something that's breaking inside of me right now. And I'm not even feeling it. I've been taking 2 a day. I'm down to 7 from 11. I'm very excited. I'm doing some other things that I talked about at my last lecture. I'm extremely proactive on the things that are coming. I have a heart issue that I got to a 0 plaque score. Free radical pathologies. You do not want to dangle with these folks when you get into the weird stuff. So believe it or not, that pill tested higher than it. I feel nothing taking it, but I know with what I do, I'm repairing something so deep inside my body, I ain't waiting until I got a lump somewhere. So I'm very impressed with that pill. I can't believe that's an incredible combination. Trademark and research. The stuff that thing can shut down in your body, you can't even put a price on. And he doesn't even know I'm talking about it like that. Go for it. That's huge.
Well, thanks for hanging in. Now we're going to dive in deeper based on a lot of your requests. So we really appreciate you getting us the questions and areas of greatest interest that we can dive into for the bonus footage. So a big area that many of you are asking about is to dive deeper on how peptides affect cellular signaling. And more so, what's the secret sauce? How are we getting peptides to be orally bioavailable? And I'm going to skip a little bit here, but bullet number 3 is part of the focus. We want to identify tripeptides that are transporting into cells using the PEP1 and PEP2 transporters. That's how we're getting it in to be active and utilized in the body. Really, really important. But we also see, getting back to the top here, receptor binding and activation. Now, when we talked about earlier utilizing the electrical line analogy, right, how we're communicating cell to cell, organ to organ throughout the body. Then we see here modulation of gene expression and looking at pathways that are responsible for that. And the key word here is modulating, not inhibiting. So making sure that the message is being received, the message is also being received accurately. That's what we're focusing on here. Now looking at enzymes, inhibiting or modulating, and this is also more general, so oral and also prescription peptides, and then the cell-to-cell communication and the microenvironment effects. So super important as we round up how peptides are affecting cellular signaling. Another major area and theme is inflammation, where we go back to the Time magazine article over 25 years ago, Inflammation, the Silent Killer. And this is now going, with LabCorp and other labs, we're able to measure on a variety of biomarkers the prevalence of how much inflammation we have, right? Some inflammation's good, too much, not a good thing, right? Short-term acute inflammation as we respond, as we repair, think about that paper cut, is part of natural processes. But what we don't want is this unresolved inflammation that continues to go on. So we look at the role of peptides in a lot of these buckets. So pro-inflammatory pathways, how do we support things like NF-kappa B, the interleukins, right? Interleukin 6, interleukin 12, immune cell activity, enhancing gut barrier integrity, So much of our immune system is in the gut. That's why when you think about a lot of the practices, a lot of the principles, you start with the gut, you take it from there. You see what hasn't been resolved. And then looking at the promotion of pro-resolving mediators. So think of high-dose fish oil or even things like PEA that we covered earlier. This is all about how do we support healthy levels of inflammation, both short and long-term within our bodies. Another big area that was requested is a deeper dive on peptides and mitochondrial health. So here we're looking at old versus young. Mitochondria are the powerhouses within the cell. This right now on a CME side is one of the hottest areas of age management, starting from repairing on a cellular level. How do we restore healthy mitochondria? How do we induce mitochondrial biogenesis? And peptides play a major role in doing this. So we see here certain peptides activating pathways, reducing and modulating oxidative stress, also improving mitochondrial dynamics, all the way down to mitochondrial enhancing function of specific tissues. So you'll see an ingredient that we went over a few times on this show, on this recording, ergothioneine. We have ergothioneine receptors in every mitochondrial, but we don't make any of it, so we rely on outside sources. This is part of Healthgevity's secret sauce, where we're combining peptides with high-powered, dose-corrected bioactives, pairing this in the body so the body knows what to do, where to go with it, and how to utilize it. Another big theme is thymic peptides and declining with age. And I teased this earlier when we were talking about the TB4 frag with thymogen. So when we look here about thymic activity that's declining as we age and the opportunity of disease and age-related disease setting in. And you'll see here why it's so important to not forget about the role of a healthy thymic gland. And peptides play a critical component. And these are peptides that can be injected, but even more so orally used long-term to be part of your regimen. And here you're seeing a publication about natural and synthetic thymic peptides as therapeutics for immune dysfunction. So here we have in several articles, several publications, thymogen, thymic peptides, right? Thymosin alpha 1, thymosin beta 4, TB4 frag 1 through 4. These are all coming up continuously in literature to reboot the immune system. Think about all the damage and stress our immune systems have gone under, especially over the last couple of years. We can all benefit at looking and considering targeted peptides dosed correctly to help restore function in our bodies. And now we talk about telomeres and longevity. So here are the key points. Longer telomeres equal healthier, longer-lived cells. So we talked about the shoelace, how they fray over time. That's what's happening on a cellular level. So we see shortened telomeres in the literature are associated with really key things: associated aging, heart disease, neurodegeneration, immune dysfunction, and even genetic instability caused with cancer. And we know by rebuilding and maintaining healthy levels of telomeres that it makes everything go better. When we think about chronological versus biological aging, resisting cellular senescence, and these are cells that don't apoptose. They stay in this stagnant, unmetabolic active area, and they take down everything around it. So they drive this low-grade inflammation. So again, key point, telomere health is critical, especially with peptide therapy. And so here we're looking at telomeres and peptides going hand in hand. Peptides offer targeted tissue-specific system balancing actions. We already hit on that peptides are reducing oxidative stress. That degrades and damages our telomeres. Peptides support stem cells and cellular regeneration, and we saw that within multiple formulas that you have access to. And last but not least, peptides may activate telomerase, and that's what's critical with restoring and reviving our telomeres.
Now, I want to, say a couple of things. I want to thank Michael from coming all the way from New Jersey and putting this together. He came just for this. I want to thank Lauren, Melissa, and Trish for watching over us in this office because this is a big deal. I want to thank Jeff and Craig for backing me up because this is very difficult to do. This lecture was done for you. I know I didn't plan on this. We are 3 salaried doctors. I didn't bring him in here. Hey, let's make a fortune. If all of you bought this stuff, we're going to get the same check the next week. This is for you. Now, it's very difficult to run an office like this. You have doctors all over that you're seeing and you're taking care of. Try to support your local doctors, support the people that you're seeing. Try to get away from the big box stuff because everybody's disappearing. The restaurants are going away. Doctors have left the job because they don't want to put up with this anymore. We appreciate all the support. This lecture was done for you. I'm the oldest guy in this room right now. I'm applying all this stuff to me. I take this stuff very seriously because I can't even imagine what I've seen in the last 5 years with what the hospitals did. They did things to my patients and killed them knowing it wasn't going to fix them. I can't process people in health that don't have your best interest in mind. I have a very bad attitude when I get near the hospitals and I watch what they've casually done to these people. It's embarrassing after taking that Hippocratic oath, which I think they should change the name. So hopefully you learned something today. I want to thank all these people for being involved. Get your health back. We're going to have an interesting future. The country's going to change here in the next few years. Who knows what's going to happen, but I want to take the best health I can into it because my entire psyche is how I feel. Everybody out there is miserable right now. We are our brother's keeper, whether we like it or not. Get well, try to do good stuff in your life, help out your neighbors. Thank God for what you have. We'll see you next time.